Welcome to 77 Questions with Chesa Dental Care. And this week we have Dr. Ritika Arora with us. Welcome, Dr. Ritika. How are you?
I'm doing well, Sakshi. How are you doing?
I'm doing good. Thank you so much. Are you ready for 77 questions?
Yes, let's do it.
Okay, here we go. Where are you from?
So, I'm basically from Delhi, born and brought up in Delhi.
Okay. Where do you live now?
I live in Mumbai, the city of dreams.
One thing you miss the most about Delhi?
Well, I would say I miss my friends the most, but definitely the Delhi food as well.
One thing you love about Mumbai?
The pace of this city, and I think it's fantastic and I just love it.
Yeah, that's true. Where do you like shopping more, Delhi or Mumbai?
Mumbai.
Any lifestyle brand you swear by?
So there's this one clothing brand which is a favorite brand of mine called Massimo Dutti. It's a luxury brand of Zara, and it's more now available in India recently. Initially it was only available in Europe. I love that brand.
Okay. Do you like to travel?
Oh yes, I do like to travel.
Favorite country you have visited?
So till now I've had a chance to visit a lot in Europe, Southeast Asia. I've been to Korea, China, but I think Europe is the best. Unless I change my views after visiting the US, but I really love Europe.
Yeah, it's beautiful. That's true.
Yeah.
Most favorite vacation spot?
Anything which is close to the beach. I just love the beach.
Oh, that's nice. Favorite restaurant in the world?
Favorite restaurant in the world. Okay, so this more than a restaurant, my evening coffee place is this one small coffee shop called Barista at just facing the beach near Bandstand. I just love that place. More than a restaurant, I think that's my go-to place. Whether I'm happy, sad, anything. I think it's the most relaxing place I've been.
Do you cook?
Yes, I do cook occasionally.
Okay. Any one dish that you enjoy most while cooking?
Mutton. Delhi style mutton.
Oh, nice. Are you a tea lover or coffee lover?
Completely a coffee lover.
Which is your favorite season and why?
So I like the season. I don't like extreme summer or extreme winter, but I like something between spring and autumn when the breeze is really nice. It's cool. It's very pleasant, and I think that's the kind of season I love.
Yeah, it's comfortable and cozy. So
Yes.
What kind of music you enjoy the most?
I love listening to retro music on a daily basis. But yeah, if I'm out for a party, then anything which is pop, hip hop, everything goes well.
Did you watch movies or TV shows?
Yes, I do. I mean, I'm not a very big TV fan, but yeah, during this lockdown, I did a lot of binge watching, and I saw a lot of TV shows during that time. Grey's Anatomy is one of my favorites.
Yeah, it is because it is based on medical industry. It's really nice. That's true.
Yes.
Any one show apart from your favorite one or any movie that you would like to recommend?
So, besides Grey's Anatomy, the other series that I like is Suits. So that's one which I would recommend if you love seeing something related to crime and law. It's one of my other favorite series.
Yeah. Do you like sports?
Well, yes, I would say I'm not like crazy of sports, but yeah, it adds fitness. So I do like some sport activities.
Which is your favorite sport, like, or anything that you used to love playing as a kid?
So as a child, I used to play basketball a lot, but I've always had a passion for tennis. I did get a chance in between a little bit to learn, but I think that's one sport which I really like.
Current social media obsession: Facebook, Instagram, Twitter, or YouTube?
I think I would say Instagram all the way.
So on an average, would you say you work for more than 8 hours?
Before this COVID time, yes, there were days when I have worked more than 8 hours too. But I used to enjoy it. I enjoy my work, so it's fine. Now I miss those times, to be honest.
What do you enjoy doing most in your free time?
Well, I think in my free time, it's sometimes watching one of the series, or to be honest, I'm not really into reading because I think dentistry has given me enough to read. So, or I'm on social media. So that's how I spend my free time nowadays.
Doctor, you look fabulous. What are top three things that you do to stay in shape?
Well, um, I think I love my evening walks, and come what may, I would not like to miss them. I am a gym person, which I'm now missing a lot. And I think the third thing is that I do drink a lot of water, which I think is really, really important for your system.
As a child, you were a naughty kid or a very shy one?
Oh, I was always a very shy kid.
What was your favorite subject in school?
I would say maths.
We heard your parents are also dentists. So did you become dentist by choice or by influence?
Well, definitely by influence. My mom's a dentist. She's an oral maxillofacial surgeon, and it's because of her that I'm here today. So definitely they had an important role in influencing me. And not only my mom, I come from a family of dentists. So that's how I am into dentistry today.
If you were not a dentist, what else would you be doing?
Law. That's my other passion. I think I would have made a good lawyer. As a kid, when I used to argue, my dad always used to say, "You can argue really well." So I think law would have been a perfect field for me.
That's why I think you relate so much with suits also.
Exactly. So one is my current career, and one was probably a dream career.
So currently, what does dentistry mean to you?
For me, today dentistry is everything. It's like my bread and butter. So now I like dentistry. So, and I don't think I can do anything else except dentistry.
From which college you have done your BDS?
So as I said, I was born and brought up in Delhi. So I did my dentistry from a college called Santosh Dental College, which is in Ghaziabad. So that's where I did my BDS from.
Did you have favorite teacher in college?
Yes, I think my favorite teacher was the teacher who used to teach us endodontics. I mean, conservative at that time. So they would probably he was one of the person who inspired me a lot.
From where have you done your masters?
I've done it from DY Patil, Navi Mumbai.
What was the subject of your masters and why did you choose that subject?
Okay, so my master's subject is periodontics and oral implantology. To be very honest, again, that was not my first choice. I wanted to do endodontics, but I wasn't getting a seat for that and I didn't want to waste a year. So what inspired me to get into this field was, now this is way back in 2003 where a lot of changes were coming in and implants were just coming into the picture. And perio was one field where we could learn implants. So that's what inspired me to get into periodontics.
Most memorable moment from your college life?
I think I enjoyed my internship the most way back in Delhi. Those were the most memorable days of our college life.
What was your journey after completing your masters and even till date? How has been that journey?
So it was, it's been a long journey. I finished my master's in 2006 and I was very lucky that immediately I got a job as a lecturer back in DY Patil. So I started my career as a lecturer in periodontics. At the same time, I started with my consulting practice. I started consulting in various clinics. And then life took a little bit of turn. I got into a little bit into facial aesthetics, a little bit into business. And now then back to dentistry, academics went way side by side, and today I have a clinic of my own, which I think is the best thing that has happened to me till date.
So, you are one of the most skilled and versatile dentists in the genre of derma and aesthetic procedures. What helped you to get where you are?
So I would call it luck by chance that I had got into, I was exposed to a certain business in between, which showed me this world of facial aesthetics. And so this was way back in 2013. And during that time, not many dentists were into this, whereas people abroad, dentists abroad, were practicing facial aesthetics on a regular basis. And I was always looking to do something different in dentistry in my master's, and I thought, okay, this is it. This is what can probably add value to my dental practice, and I said, let's go for it.
What do you enjoy practicing more, dentistry or facial aesthetics?
I think I like the mix of both. I have made my practice in such a way that I can combine dentistry and facial aesthetics. There are days when I love dentistry. I love, because I'm a periodontist, I like doing implants, I like surgeries, the blood. But then after a long tiring day, when I switch back to facial aesthetics, I'm like, wow, this field is so clean, so convenient, so quick, and the amount of money I need in doing 5 hours of surgery, I probably make the same amount of money in maybe like 20-30 minutes. So
Yeah,
why not,
yeah, that's true.
Yeah.
Your message to the dentists who are interested in the career in facial aesthetics.
It's a fantastic career to get into, but I think one message that I would like to give everybody is, because a lot of people come to me and ask me, that we just passed out from college, we want to pursue this as a career. I would say first, learn what you have spent doing for 4 years, 5 years, because dentistry is always going to be your bread and butter. It's always going to be your base. Get your dentistry right, get your clinic practice into place, and add this facial aesthetics as that extra edge over another clinic, Just doing dentistry and immediately jumping into facial aesthetics is probably not the right path to go. Let this be an additional, add value to your practice.
So you were an entrepreneur too in the past. What was that brand about?
So way back in 2013, through a distant family, I was asked if I was interested in getting into skincare business, and they wanted to set up a few clinics in Mumbai. And at that time, I was just doing consulting, I was into academics, and I was looking for a break, I was looking for a change, and I said, why not? And they did land up setting up 2 clinics here. I was there from the start till the clinic started running and functioning. The brand's called About Face. And that's where I got to explore my entrepreneur skills or business skills. So it was a complete different change and a complete different world from dentistry.
What was your exact role in About Face?
So the title that I had over there was actually of a chief medical officer, and because I was involved in getting the business up, so I did myself a lot of trainings in facial aesthetics and other derma, skin lasers and everything. After training, I used to train the other doctors, hire the other doctors, take care of those clinics. So it was, managing the medical side as well as taking care of the clinic. So it was a business come a clinical job. So, and it was nice. It was a good break.
You have a list of many accolades under your name. Are you planning to study more?
So I think with the mom, the way life is moving, the pace at which changes are happening, there is so much change that happens in dentistry every month, I would say, and it's very important that you keep yourself updated. So I think it's an ongoing journey. I would still, even during this lockdown, I learned so many things, and I still keep feeling, every 5th or 6th case tells me, oh, there is something more I need to learn maybe. So I would love to keep myself updated and continue this education as long as I can.
That's very inspiring, doctor. Do you have your own clinic?
Yes, I have my own
What
clinic.
is its name?
It's called Aesthetic Smiles Dental Clinic and Facial Rejuvenation.
Top three treatments that are done at your clinic.
Okay, so my focus is more on smile makeovers, dental implants, and obviously facial aesthetics.
What is your favorite procedure to practice?
Um, my favorite procedure is, I would actually call it a combination of a smile makeover with a face makeover. Because since I'm skilled in doing facial aesthetics and I love doing cosmetic dentistry, so if I get a chance to do a complete dentofacial aesthetic procedure, that's what I love.
Do you also consult in other clinics?
Yes, I do also consult in other clinics.
Most memorable consultation that you remember?
I would call it my first consultation. This was in 2007. I have just passed out of my master's, and when you're looking to, it's like a new job you're looking for. And the first clinic you get to do a case, I would still remember it. They call it the first money you earn from your first procedure.
Yeah.
I think that was the most memorable moment.
On an average till date, how many clinics do you think you have consulted at?
Well, I think I would say maybe more than 100 clinics till date now.
Okay. In one line, what's a patient's smile mean to you?
I would say a happy smile which gets that sparkle in their eye.
Okay. So, as I have mentioned before, also that you look beautiful. Please share your personal skincare routine with us.
Well, I don't do anything special. It's just the normal routine, a face wash, and in the morning, evening, drink a lot of water. And yes, because I run a facial rejuvenation center, I make sure I do some rejuvenating procedures. I have other doctors working with me. So I tell the cosmetologist, once in a while, do something to my face so that it looks fresh and nice. That's about it. Nothing very special, just the regular routine.
Your most challenging case till date?
Well, every case has its own challenges, but I think I would term my first implant case, which was supposed to be in a consulting practice. Again, I had just passed out of my dentistry, and there is this new clinic I go to consult, and I had to do an immediate extraction, placement of an implant, and when in a consulting practice, you're not only answerable to the patient but as well as to the doctor. So it was a challenging case, but I think it was also a new case. I still remember, I must have checked everything 5 times to make sure I put in all the instruments, I put everything. And funny, the case went well, but I think, and this was again, as I said, when you pass out of, you're just finished your post-grad, you're not that used to doing private practice, so the scenario is completely different. So I would call it that was one of those challenging days.
3 values that you have learned from your parents?
I would say honesty, hard work, and determination.
It's very nice. Have you had any mentors in life?
Yeah, I would probably say my parents are my mentor. But I would also like to say that every person who has come into my life, or every person I come across, somewhere is a mentor somewhere, somehow, because there is always something you can learn from a person. So all the people who have made a difference to my life are probably all the mentors, I would say.
So, what does mentorship mean to you when someone is looking at you to, just guide them in life?
Well, my always aim would be that I have associates working with me, I have other doctors working with me, and my aim is always like to share whatever knowledge I have learned. I mean, I'm also somewhere learning down the line, but whatever I have learned, and I always try to tell them, that this is the mistake I made. so you don't make that mistake, So I always share my mistakes with them, my challenges with them, so that they don't have to go through that.
Do you teach?
Yes, I do teach. So until last year, I was attached to a dental college. I was working as a professor and head of department teaching periodontics to undergrad BDS students. And I also teach facial aesthetics because that's what I'm passionate about.
Which is your favorite topic to teach?
If I have to choose between perio and facial aesthetics, definitely facial aesthetics.
What is one thing that inspires you to teach or interact with students on regular basis?
So as I said, since I teach facial aesthetics and it's one of the upcoming fields, and I felt, that I got a chance to learn this, so why not, pass this knowledge on to others also, because somewhere it would help somebody to add value to the practice. So I just decided, that I should definitely get into teaching as well.
Okay. How does one sign up for your course?
So I do a lot of advertisement on Facebook, social media platforms, as well as I lecture in conferences. Now it so happened that people usually just message me and ask me, when is your next course happening, and they can easily sign up.
Rate on a scale of 1 to 10 education options post MDS in India.
I would say probably 6 to 7. Initially, there were not too many options, but lately, I think there are a lot of diplomas or courses which are coming up. So there are still, now people still have, even after they've done the MBS in a particular subject, if they want to learn something more, there are avenues open now that they can.
5 things that have changed in Indian dental industry over the past 10 years.
Oh, there has been a major change. I think a few of the biggest changes have been dental implants, lasers, the digitalization that is happening in terms of X-rays, CBCTs, and I think one major thing is also dental photography, which didn't have so much importance back 10 years back, but today it's one of the most important fields.
According to you, what are the top 3 qualities every dentist should have?
Top 3 qualities. Okay, so I would say hand of an artist, brain of an engineer, and heart of a doctor.
That's really nice answer. Top achievement of your life?
Very proudly, I would like to say that where I am today. I mean, it's been a long journey. As I mentioned, I'm from Delhi, and my mom had 20 years practice back there. So when I came to Mumbai in 2003 for my master's, that was the time I decided, that I like the city and I want to stay here. So I could have chosen to go back to Delhi because I had a platter practice ready for me. I didn't have to do anything. I had to just go back, sit with her. But I chose to stay here and start from the scratch. And I would say 15 years, and I worked hard to be where I am. I mean, there's still a lot more to do, but I think that's the biggest achievement.
Okay. What is your success mantra?
My success mantra, I would say, is to have a vision of what you want and then figure out a path which is going to lead you to that vision. If you don't have a vision of what you want or where you want to be, you can't be successful. You have to be ambitious, you have to be aimful to be successful.
Your strengths and weaknesses?
My biggest strength is, I think, my ability to be patient. And my biggest weakness is when I lose my patience.
Okay. What is the one thing in life that you are most excited about right now?
Well, I would say that I'm waiting for season 2 of 2020. I'm just waiting for this season 1 to get over, and we soon go into season 2. And I hope this month is the grand finale.
I think all of us are waiting for that.
Yeah.
One goal on your bucket list for the future?
One goal. Okay. I would say more than a goal, it's a dream. Obviously, the goal is to have a successful dental practice. And since I'm a beach lover, I would love to have a practice just facing the beach. When I'm working on the patient and I can see the beach, I think that is what I aim one day, or that's what my goal future is.
Okay, that's very nice and beautiful. Any advice for young dentists who want to set up their practice or recently started in current times?
I would just say that it's this year is probably all about survival, and just be patient, just be determined, be positive. And dentistry, everybody does need dental treatment. So it's not, the COVID will go away, but the cavities are not going to go away. Missing teeth are not going to go away. So just hang in there, and you will do fine in the coming years.
That's true. When do you feel dentistry will bounce back to its full capacity?
I would say that we've already started now. We are much better what we were last month, or 2 or 3 months back. And it's a matter of maybe another 2 or 3 months. Probably next year would be a better year, and we will be back where we were.
How will dentistry change after COVID times?
So a lot has changed in the people's mind regarding their personal hygiene, regarding sanitization and sterilization, and the way personal hygiene has become so important. I think they would also be very conscious of their oral hygiene, and what they probably would also be looking for is in every clinic the level of sanitization and sterilization, because they realize the importance of all this. And if you don't go by those protocols, I think you will lose the race, So people are now very, very conscious already. So you have to be very good at what you are. Otherwise, it will become very difficult to survive in dentistry.
What preventive measures are you taking to protect your staff and patients from COVID-19?
So over the months, we've seen so many guidelines come in through the IDA, through the DCI, and whatever I could adopt to, starting from video consultations to working only strictly by appointments, temperature check, oximeter check, basic disposable for the patients, the PPE kits, the HEPA filter, UV light, high wax suction, UV chamber. I think I've managed to have all the protocols in place to keep my patients as well as my staff safe.
You have been associated with Chesa Dental Care for quite long now. How is that experience?
So I would say, as I mentioned before, that my mom's also a dentist, and we had a practice in Delhi. I still remember, and I think this would be even before I joined dentistry, way back before 1996 even, that so my mom used to take me for all these exhibitions and conferences that used to happen. And that was one of the years where my mom wanted to change her chair. I still have a faint glimpse of Dr. Anju standing at that stall, and because that was the chair at that time my mom had decided to buy, and this is like really way back, I think 94, 95 or something. And that's where my association with Chesa started. And that time they were based in Bangalore, and we had a new chair installed in the clinic. And I still remember, if there was any problem, my mom would just pick up the phone. There was this one time we got stuck with the chair, got stuck, and she just called up Dr. Anju. It was around 8:30 in the night, and she was so sweet. She just guided my mom through all the steps to be done so that our practice doesn't get stalled the next day. And since then, even when I shifted here, the chair came with us here. In the beginning, my mom was practicing alone. Then I changed, made a new clinic. And I think today, 80% of the equipment in my clinic is from Chesa Dental Care. So my journey goes back, way back with them, and they've progressed so much. It's a fantastic company to be with. Dr. Shalika, the second generation, she's just following her parents' footsteps, getting a company like Megagen Implants, which is a world famous company in India, and making a place, making a market for it. I've been a Megagen user for the last 2 years, and I'm absolutely happy with them, And anybody from the dental field, any dentist who's looking for a long-term association, I think Chesa is the family to be associated with. I would proudly say that.
Thank you so much for your kind words, ma'am. Your views on Chesa Academy.
So I think this was another project. They always wanted to start the academy part. And it started in the COVID times, if I'm not mistaken. And
Yeah.
I still remember every day without fail, they would have a webinar, and the topics were so fantastic. It was, I think for me, it was set that 3 o'clock, the webinar is going to start. So I would finish my lunch and get onto my laptop to see what's happening today. And it's an excellent platform for all the upcoming dentists, speakers, to showcase their talents, their knowledge. And I think it also lays a foundation for new research and new innovations, because, and you guys are still on with it, so which is really amazing, So I think it's really, really nice.
Thank you so much, ma'am. We have come to last 2 questions. So your thoughts on our 77 question interview?
A very different and innovative concept. We often see our fellow colleagues from not only from, like, if I'm based in Mumbai, I would see a dentist, he's in Delhi or she's in Delhi or in Chennai, and we would often wonder, what their personal life would be, or what would be their behind the scenes kind of thing. So I think it's a great insight into knowing your fellow colleagues besides outside the dental world.
Yeah. A short message to our viewers.
Okay, so there's a very famous saying, even on a cloudy day, the sun is shining somewhere. This too shall pass. वो दिन नहीं रहे तो ये दिन भी नहीं रहेंगे. So just be positive and move on.
Thank you so much for those inspiring words, ma'am. Thank you so much for giving us a time. It was wonderful talking to you.
Thank you, Sakshi, and thank you, Chesa Dental Care, once again to have me over here. Thank you.